11 o'clock at night. Your apartment is quiet. You pull the blanket up, roll onto your side, close your eyes, and within minutes you are gone. You do this every single night. You have done it thousands of times without a second thought. But while you are unconscious, your body is running a full operation. It is repairing damaged tissue. It is clearing metabolic waste from your brain. It is regulating blood pressure, consolidating memory, releasing growth hormone, managing every hormonal cycle that keeps you alive and functional the next day. And here is what nobody tells you. Every single one of those processes is affected by the physical position your body is in while they happen. Not slightly affected, structurally affected. The angle of your spine, the compression on your chest, the orientation of your airway, the pressure on your internal organs, all of it changes depending on whether you are on your back, your side, your stomach, or some twisted combination of all three. 15 years of clinical practice have taught me one consistent lesson. Most people are sleeping in a position that is actively working against their body, not because they chose wrong, because nobody ever explained what the right position actually does, and more importantly, what the wrong one costs you over 10, 20, 30 years. You spend roughly a third of your entire life asleep. That is not a passive activity. That is a third of your existence spent in one physical configuration, loading the same joints, compressing the same vessels, restricting the same airways, night after night after night. If that configuration is wrong, the damage does not announce itself. It accumulates quietly until your doctor hands you a diagnosis and calls it aging. Subscribe and tap like right now. The system does not make money when you sleep well. It makes money when you don't. Help Dr. Johnson reach 200,000 subscribers. Every single one counts. Most people believe that during sleep, the brain simply shuts off. That is completely wrong. During deep sleep, your brain activates a dedicated waste clearance network called the glymphatic system. Think of it as an overnight cleaning crew. This system flushes out metabolic byproducts, including beta amyloid, the protein directly associated with Alzheimer's disease. It works by pushing cerebrospinal fluid along channels that run beside the blood vessels in your brain, physically washing away the toxic residue of a full day of neural activity. Here is the part that changed how neurologists think about sleep. Recent research shows that the efficiency of that flushing process changes significantly depending on your head and body position. The same 7 hours of sleep can produce very different levels of brain detoxification depending on how you are lying. Same duration, different outcome. Position is the variable, and the brain is only the beginning. Sleep is when your cardiovascular system gets its only real break. Heart rate drops. Blood pressure falls by 15 to 20%. Blood vessels relax and repair. Growth hormone is released, triggering tissue restoration throughout the body. Cortisol, your primary stress hormone, is supposed to reach its lowest point in the middle of the night. If any of those processes are disrupted, and body position can disrupt several of them at once, you wake up with inflammation you cannot trace, fatigue you cannot explain, and pain you blame on age. Your doctor runs basic blood work, finds nothing alarming, and tells you to get more rest. But more rest in the wrong position does not fix the problem. It deepens it. Most people focus entirely on how many hours they sleep. The real question is what your body is able to accomplish during those hours. And that depends on position more than almost anyone realizes. By the way, if you are over 50 and you have been curious about new health options or clinical research happening near you, Care Health is the link on my channel page. A lot of you have already checked it out. Now, let me walk you through what each sleeping position actually does to your spine. You have probably heard that sleeping on your back is the gold standard. Spine aligned, weight distributed evenly, no facial compression. On paper, it sounds perfect. In practice, it is the single most dangerous position for a large portion of the population, and most of them have no idea. Here is why. When you lie flat on your back, gravity pulls your tongue and the soft tissue at the back of your throat downward toward the posterior wall of your airway. In a person with a wide open airway, that causes no issue. But in someone with even a mildly narrowed passage, and that includes a significant number of people over 50, that collapse can partially or completely block airflow. This is obstructive sleep apnea. The airway closes. Oxygen saturation in your blood drops. Your brain, sensing danger, triggers a microaerosol, a brief jolt just strong enough to restore muscle tone and reopen the passage. You gasp, you breathe, the airway opens, and you fall back asleep. You never fully wake up. You never remember it happened. And then it happens again. Sometimes 30 to 60 times per hour. The consequences are not subtle. fragmented sleep architecture, chronic low-grade oxygen deprivation, elevated nighttime blood pressure, increased risk of stroke, accelerated cognitive decline, and after 50, the throat tissue that holds your airway open loses muscle tone and becomes progressively more collapsible. Back sleeping gets more dangerous with every year. There is a second problem: acid reflux. When you lie flat on your back, the valve between your stomach and your esophagus sits at the exact same level as the stomach contents. Gravity offers zero help. Acid creeps upward, sometimes reaching the throat, sometimes the lungs, silently, while you sleep. Chronic silent reflux damages the esophageal lining over years in ways that produce no obvious symptoms until the damage is serious. Back sleeping is excellent for some people. It is genuinely harmful for others, and most people have no idea which group they belong to. If back sleeping has hidden dangers, stomach sleeping has visible ones. Most orthopedic and neurological specialists consider it the most problematic position you can sleep in, and the reasons are mechanical. Start with your neck. To breathe while lying face down, you must turn your head 70 to 90 degrees to one side. That is near the anatomical limit of cervical rotation. Held for a few seconds, that is a stretch. Held for 6 to 8 hours, that is sustained compression of the vertebral arteries, the vessels that supply blood to your brainstem and cerebellum, structures responsible for balance, coordination, and vital autonomic functions. In younger people, those arteries can tolerate that compression without consequence. But after 50, when arterial walls are stiffer and often partially narrowed by plaque deposits, sustained rotation for an entire night can meaningfully reduce blood flow to the posterior brain. That is not a theoretical concern, that is vascular mechanics. Now move down the spine. Prone position forces your lower back into hyperextension. The natural curve of the lumbar spine deepens excessively, compressing the facet joints, the small paired joints along the back of each vertebra. Over years, this accelerates joint arthritis and disc degeneration in the L4, L5, and L5S1 segments, exactly the two levels responsible for the majority of lower back pain. And then there is breathing. With your chest pressed flat into the mattress, your diaphragm, the dome-shaped muscle that drives respiration, cannot fully descend. Your lungs cannot fully expand. Your lungs cannot fully expand. Every breath you take is shallower than it should be. Your body receives less oxygen per cycle all night long. Some stomach sleepers tell me it reduces their snoring. That is true. Gravity pulls the tongue forward rather than backward, and the airway stays more open. But that single benefit does not come close to outweighing the cumulative cost to your neck, your spine, your vessels, and your lungs. This is where most people get surprised. You sleep on your side. Good. But which side matters far more than you think. And the difference is not a matter of preference. It is a matter of anatomy. Your heart sits slightly left of center in your chest. When you sleep on your left side, the heart rests in its most natural anatomical position, supported by the mediastinum, the central compartment of the chest. The inferior vena cava, the large vein that returns blood from your lower body to the heart, enters from the right side and remains unobstructed. The aorta, your body's main artery, curves leftward as it exits the heart and is not compressed. Blood flows the way it was designed to flow. Studies have also shown that left-side sleeping improves lymphatic drainage from the brain through that glymphatic system we discussed earlier. This is one of the reasons neurologists are increasingly interested in sleep position as a modifiable factor in cognitive aging. Same sleep, better waist clearance, simply because of which side you chose. Now flip to the right side. When you sleep on your right, the weight of your abdominal organs shifts. Your liver alone weighs roughly 1.5 kilograms. That mass presses against the inferior vena cava and can partially impede venous return to the heart. For a healthy person, that is inconsequential. But for someone with heart failure, even mild, right-side sleeping measurably increases cardiac workload overnight. Then there is your stomach. The stomach curves in a way that when you lie on your left, the gastroesophageal junction, the valve between the stomach and the esophagus, sits above the level of the stomach contents. Gravity keeps the acid down naturally. On the right side, that junction drops below the acid line. Studies using pH probes placed directly in the esophagus during sleep consistently show that right-side sleeping produces significantly more reflux episodes than left-side sleeping. That is not opinion, that is measured data. Now let me address the position that more people default to than any other, the fetal position. Knees pulled up, spine curled forward, arms tucked in. It feels instinctively safe. It feels comforting, and that is exactly why so many people have been doing it for decades without questioning it. But comfort and physiology are not the same thing. When you curl tightly into a ball, your thoracic spine flexes forward, your chest cavity compresses, your diaphragm, the primary muscle responsible for breathing, cannot fully descend. Breathing becomes shallow, restricted to the upper portion of your lungs. Over an entire night, that reduced respiratory capacity means less oxygen delivered to every tissue in your body. You sleep 7 hours and wake up feeling like you slept 4. People blame the mattress, blame stress, blame age. The real culprit is a chest that never fully opened. The second cost hits your hips. Extreme hip flexion in the fetal position shortens the psoas muscle, a deep hip flexor that connects your lumbar spine directly to your femur. When this muscle stays shortened for 7 hours every night, it pulls the pelvis into an anterior tilt. That tilt loads the lower back unevenly. This is one of the most overlooked causes of morning back stiffness that no amount of stretching during the day fully resolves. Third, tight knee flexion compresses the cartilage on the inner side of the knee joint unevenly. For anyone with early osteoarthritis, that sustained overnight compression increases morning pain and stiffness before you even take a step. The solution is not to abandon side sleeping, it is to open the position up, knees gently bent, not pulled to the chest, a pillow between the knees to keep the hips aligned, spine relatively straight rather than curled. That single adjustment preserves every cardiovascular and digestive benefit of side sleeping while eliminating the orthopedic damage of the tight curl. You can choose the perfect sleep position and still wake up in pain every morning, because the position is only half the equation. The other half is what you are lying on. Start with your pillow. The entire purpose of a pillow is to fill the gap between the side of your head and the mattress so that your cervical spine, the neck portion of your backbone, stays in a neutral horizontal line. That is the only job. If the pillow is too high, your neck is pushed into lateral flexion, compressing nerves on one side and stretching them on the other. If the pillow is too flat, your neck drops below the level of your spine, creating the opposite strain. Either way, you are loading your cervical discs asymmetrically for 7 hours straight. After 50, cervical disc degeneration is nearly universal to some degree. A misaligned neck during sleep does not cause that degeneration, but it accelerates it measurably. The numbness in your hands that wakes you at 3 o'clock in the morning, the stiffness in your neck that takes an hour to loosen, those are not random. Those are 7 hours of sustained misalignment, producing predictable symptoms. Now the mattress. A surface that is too firm does not allow the shoulder and hip to sink in during side sleeping. Those two contact points bear excessive pressure, blood flow is restricted. Your body responds the only way it can, it turns over. Each position change partially wakes the brain, fragmenting your sleep architecture without you ever knowing it happened. You sleep 8 hours and feel exhausted. That is not insomnia, that is a mattress forcing your body into constant micro-adjustments. Too soft is equally destructive. The torso sags, the spine curves, and lumbar discs take uneven load all night. Here is the simplest diagnostic I can give you. If you wake up with pain that was not there when you went to sleep, the problem is almost certainly your support surface, not your body. Everything I have explained so far might sound like theory. This chapter is the data. Sleep laboratories routinely measure oxygen saturation, heart rate, blood pressure, and respiratory events across different body positions during overnight studies. The differences between positions are not subtle, they are clinically significant and repeatable. Supine sleeping, lying on your back, consistently produces the highest number of apneic events in people with any degree of sleep-disordered breathing. The airway is at its most vulnerable. Oxygen saturation drops lower and stays lower than in any other position. Nighttime blood pressure, which is supposed to fall during sleep, often remains elevated or spikes repeatedly as the brain triggers microaerosols to reopen the airway. Prone sleeping on the stomach produces the best oxygen saturation numbers for apnea patients because the tongue falls forward and the airway stays open. But spinal alignment scores are the worst of any position. The respiratory benefit comes at a direct orthopedic cost that accumulates with every passing year. Left-lateral sleeping on the left side consistently produces the most stable blood pressure profile and the lowest cardiac workload. This is particularly pronounced in people over 60, where the cardiovascular system has less reserve and is more sensitive to positional changes in venous return and cardiac output. What most people do not realize is that positional therapy is an actual medical discipline. Sleep clinics worldwide train patients to sleep in specific positions to manage conditions like sleep apnea, acid reflux, and heart failure, without adding a single medication. This is not alternative medicine. It is supported by randomized controlled trials and used in accredited medical institutions. Sleep position is not a preference. It is not a comfort choice. It is a physiological variable with measurable consequences for your heart, your brain, your blood oxygen, and your long-term health. And unlike most medical variables, it is one you can change tonight. I mentioned the glymphatic system earlier. Now I want you to understand why this single discovery is reshaping how neurologists think about sleep. The glymphatic system was only discovered and named in 2012. That means the majority of practicing physicians today were never taught about it in medical school. It simply did not exist in the textbooks they studied. Here is what it does. During deep sleep, cerebrospinal fluid, the clear liquid that surrounds your brain, flows along channels that run beside blood vessels and physically washes out metabolic waste. That waste includes beta amyloid and tau, the two proteins most strongly associated with Alzheimer's disease. Your brain produces these byproducts during normal daily activity. The glymphatic system is what removes them, and it operates almost exclusively while you are asleep. Now here is the part that connects directly to everything we have been discussing. Animal studies published in peer-reviewed journals showed that lateral sleeping on the side produced significantly more efficient glymphatic clearance than either supine or prone positions. While human data is still accumulating, the direction of the evidence is consistent across studies. Think about what that means practically. If you sleep in a position that restricts glymphatic flow, you can get enough hours, you can reach deep sleep stages, and your brain may still not be clearing itself adequately. Night after night, year after year, that impaired clearance allows neurotoxic proteins to accumulate in brain tissue. This is not a guarantee of disease, but it is a modifiable risk factor. And modifiable risk factors are exactly where prevention lives. You cannot control your genetics. You cannot reverse your age, but you can change the position you sleep in tonight. This is one of the most active areas of neuroscience research right now. The connection between sleep position and long-term brain health is likely to become standard medical guidance within the next decade. You do not need to wait that long. Here is the part that ties everything together for anyone over 50. The position that worked perfectly at 30 can actively destroy you at 55. Not because the position changed, because your body did. Start with your spinal discs. At 30, your intervertebral discs are plump, hydrated, and resilient. They absorb and redistribute pressure from almost any position. By 55, those same discs have lost 20 to 30% of their water content. They are thinner, stiffer, and far less forgiving. A spinal alignment that caused zero symptoms 2 decades ago now produces morning stiffness and pain because the disc can no longer compensate for the misalignment. The position did not get worse. Your body's tolerance for it did. Move to the respiratory system. Lung elasticity decreases with age. The chest wall becomes stiffer. Respiratory muscle strength declines. Any position that mechanically restricts breathing, prone, tight fetal, has a proportionally greater impact on oxygen delivery after 50 than it ever did at 30. The same restricted breath that your younger lungs handled without issue now produces measurably lower overnight oxygen saturation. Then there are your blood vessels. As arterial walls stiffen and venous valves weaken, the effect of gravity during sleep becomes more pronounced. Fluid that pools in your legs during the day mobilizes at night when you lie flat. Sleeping positions that elevate the legs slightly above the heart can facilitate this redistribution earlier in the evening, potentially reducing nighttime urination. Position becomes a tool, not just a comfort choice. And joints. Sustained pressure on an arthritic knee for 7 hours is fundamentally different from pressure on a healthy one. A pillow between the knees for hip arthritis, a slight upper body elevation for shoulder impingement, these adjustments stop being optional comforts and become medically necessary. Your sleep position is not a decision you make once. It needs to evolve as your body does. How old are you? Write it in the comments. I want to know which age group this hits hardest. Here is exactly what to do starting tonight. Your default position is left-lateral, modified. Lie on your left side, knees gently bent, not pulled to the chest. Place a supportive pillow between your knees to keep the hips aligned. The pillow under your head should fill the gap between your shoulder and your ear exactly, keeping the cervical spine in a straight horizontal line. Arms positioned in front of the body, not tucked under the pillow or under your head. Chest open, shoulders relaxed. That is the foundation. Now the adjustments. If you have significant acid reflux, elevate the head of the bed by 15 to 20 centimeters using blocks or a wedge under the mattress, not extra pillows. Extra pillows bend the neck without changing the angle of the esophagus relative to the stomach. The acid stays exactly where it was. If you snore heavily or have sleep apnea, avoid sleeping on your back at all costs. A simple technique is sewing a small pocket onto the back of a sleep shirt and placing a tennis ball inside. When you unconsciously roll onto your back, the discomfort wakes you just enough to reposition. If you have lower back pain, a small rolled towel under the waist while side sleeping maintains lumbar curve support. If you have shoulder pain, sleep on the opposite side and hug a pillow against your chest to prevent the top arm from pulling the injured shoulder forward. Now, an honest expectation. You will not retrain your sleep position in one night. Your body will default to its old habit within minutes. That is normal. Positional retraining takes roughly 3 to 4 weeks. Fall asleep in the target position. When you wake during the night, consciously reposition. Within a month, the new position becomes automatic. Room temperature between 16 and 19 degrees. Complete darkness. No screens for 30 minutes before bed. That is the environment where the correct position delivers its full benefit. Everything we covered today comes down to one reality. Your body after 50 is not the same machine it was at 30. The positions, the habits, the routines that used to be harmless are now actively costing you sleep quality, cardiovascular stability, joint health, and possibly long-term brain function. And the hardest part is that the standard 12-minute doctor's visit was never designed to walk you through any of this. That is why I want to tell you about something that has genuinely been changing lives in this community. If you are watching this and you are in the United States, there is an opportunity that ties directly into everything we just discussed. It is called Care Health. Care Health connects you with clinical trials and innovative health programs happening right in your area. Sleep research, cardiovascular studies, metabolic health, joint health, brain aging. There are active trials right now looking for participants, and many of them offer treatments and monitoring that go far beyond what a standard office visit provides. Clinical trials give you access to cutting-edge approaches before they become widely available. You get detailed health evaluations, close medical monitoring, and in many cases compensation for your time. This is not about being a test subject. This is about taking an active role in your health instead of waiting for the system to hand you another pill and another bill. I need to be direct. This is exclusively available to US residents, and spots are limited. Thousands of viewers from this channel have already signed up. The trials that are open today may not be open next month. Click the link on my channel page or scan the QR code on screen right now. Open your phone camera, point it at that square, and tap the link that appears. If you are watching on your phone, tap my channel profile picture to go to the channel page. A screenshot is on screen showing you exactly where to find it. Spots are filling up fast. Do not wait until it is too late and wish you had acted when you had the chance. 30 seconds, a short form, and a door opens to genuinely better health.